Hey guys, welcome to the Lean to the Left podcast, where we focus on the important social issues of our time. Healthcare is one of those core issues that we track here at Lean to the Left, and nurses across America are crucial to that healthcare. Unfortunately, many challenges face nurses today, including shortages, staffing issues, stress and burnout, technological advancements, wages and compensation, and the fact that everybody's getting older, including patients and nurses themselves. In addition, private equity firms are buying hospitals, nursing home, and emergency services, cutting nursing staff and causing an increase in patient harm. To address all this, we have with us today Kathy Allen, founder of Gutsy Nurses and author of the upcoming book, Gutsy Nurses Save Lives. She's a board certified holistic nurse with over 20 years of experience working with people suffering from traumatic stress. Kathy, thanks so much for joining us today on the Lean to the Left podcast.
Thank you for inviting me. I'm really looking forward to sharing what I know to possibly help people.
It's a pleasure. Thank you for joining us. Now, can you give us a snapshot view of what's going on with nurses today? How do all of these factors that I mentioned affect nurses and their ability to give quality care?
It really does affect nurses' ability to give quality care. And when nurses can't give quality of care, that affects patients and a patient's recovery. And what's happening today is nurses are working too many hours. They were promised that they could work 2 or 3 12-hour shifts and then have 4 days off. That's not really happening in a lot of hospitals. Nurses work 12 hours, sometimes even up to 14 or 16 hours, and have to work the next couple of days also. That leads to a sense of isolation from their family. It's after 8 hours, the research shows that no matter where you work, after 8 hours, it's more common for mistakes to take place. And so, especially, you don't want that in healthcare. So, what they're doing with nurses today, and in addition to having them work way too many hours and become exhausted, they're
Mhm.
also having them take care of too many patients and have a high level of acuity for your patients. Then some of those patients aren't going to get the care that they need. And I have an example. I have a
Okay.
friend who was working at a hospital. She's a registered nurse. She had 5 patients to care for, and they all needed something from her at one moment. And she couldn't get to all of them, so she tried to get the nursing assistant to help her. The
Mhm.
nursing assistant had 13 patients. Now you can imagine, if you go to the hospital, you're not going to go just because you've got an overgrown toenail or something. You're going to go because you're sick.
Right.
And you've got a nursing assistant taking care of you and 12 other patients. What kind of care do you think you're going to be getting? How's that going to affect your recovery? And I think it's going to affect it quite negatively. Another thing for nurses is a lot of nurses are complaining and saying that they want more help. And sometimes, not always, but sometimes those nurses are retaliated against or even fired for complaining. So that's pretty awful.
Oh my God. You mean to tell me if you're in a ER and the stress is getting to you and you really need to have some help, if you complain about the conditions, you could get fired for doing that?
This is true. Not all hospitals, but some hospitals will fire you.
Tell me, why is it that I have never been able to understand? Why is it that doctors and nurses, doctors too, have to work these horribly long shifts, sometimes back to back?
Yeah.
Why?
It didn't used to be that way. It
Yeah.
used to be that the doctor was in charge of their patient. The doctor decided if that patient needed to be hospitalized. The doctor would go and make rounds in the morning at the hospital before he went to the office, and then make rounds again in the evening to make sure the patient was all right and if they needed anything. That's totally changed since for-profit healthcare took over. With for-profit healthcare, your personal private physician isn't allowed to have hospital privileges. The doctor that will see you at the hospital is called a hospitalist. And people were told at the beginning that it would be a doctor who would be seeing these patients that came into the hospital. In order to save money, the for-profit industry now doesn't always use a doctor. Sometimes they'll have a physician's assistant or a nurse practitioner who will be in charge of seeing the patient. There was one doctor that I know about, he had 17 patients to care for, 17 patients that he didn't know to care for in a 12-hour period. When he complained, the person he complained to, and I don't know who it was, said, just think of it this way. You're going to have more skin in the game if you take on more patients. You're going to make more money. As if saving somebody's life is not enough skin in the game. So
He's
that's
so
pretty
flip.
sad.
Yeah. So what you're telling me is that nurses are being exploited and it's being done simply out of greed in the pursuit of profit.
And the profit, it's all for profit. But it's not only nurses that are being exploited, patients are being exploited.
Uh-huh.
Patients make this whole thing go. It's their insurance, their money that makes the whole process continue. In addition to that, the healthcare, as you mentioned before, private equity firms whose whole purpose is to make money are buying hospitals, nursing homes, and emergency services.
Mm.
And when they do that, there was a question about how does that affect patient care? And so the Harvard Medical School did a study to see how private equity firms affected patient care. And what they found is that the private equity firm, first thing they do is reduce the number of nurses, to reduce the staff. Then the next thing they do, they reduce staff. And the Harvard Medical School found out that the effect of that was that patients were suffering more falls. There was an increase in wound infection, an increase in bloodborne infections, and an increase in adverse reactions after a medical or a surgical procedure. Now, people who are investing in private equity firms, I'm sure they're not really aware of this. I don't think that they would be investing in something that they knew would cause harm, but harm is being caused. Now, what happens when people fall out of bed or when there's more infections? You've got to do more tests. So you've got to do more x-rays and maybe CAT scans or MRIs and lab work. All of those tests bring in money to the hospital. So it's a kind of a crazy thing.
Oh my God. So that brings me to this question. What right now we are seeing the Trump administration, I guess it's a administration. We are seeing Donald Trump and his cronies trying to cut all these healthcare programs, Medicaid, the
Yeah.
Affordable Care Act cuts there.
Yeah.
How do you see that? What do you see happening?
Well,
And what's the
I
impact of
think it's
all this,
terrible.
Kathy?
Yeah. I think it's really terrible and it's going to affect a lot. If it goes through, it's going to affect a lot of people. But
Uh,
one thing to be aware of is that the corruption in so many areas of our society is becoming more and more apparent to people. There's a saying that denial is the shock absorber for the heart. And all of us have been in denial about a lot of things. Oh, it couldn't be this bad. People just couldn't be this evil. But now people are coming out of denial. And I think we're in a time in our society where it's ripe for change. And there are a lot of healthcare providers who are creating new kinds of ways of helping people stay healthy. So it's not hopeless. I know
that
that
is good news.
it is good news.
Yeah,
And
yeah.
my belief is that we're not going to change the hospital system because there's too many people making too much money off of it. But what we can do is we can dry up the market. We can keep people healthy. And there are lots of doctors and nurses who are starting new programs, holistic programs, functional medicine, energy healing, light therapy, lots of programs that can help people stay healthy and stay out of the hospital.
You're in that game too with Gutsy Nurses, right?
Yes.
Let's talk about that. What's your mission and what are you doing and to achieve
Well,
it?
I grew up in a home that was very, very dedicated to social justice.
Uh-huh.
And I grew up in that kind of an environment. And
Okay.
so when I became a nurse, I'm so old that I was at the steps of the University of Michigan when John Kennedy gave his speech about starting the Peace Corps. And I was
Okay.
going to join the Peace Corps, but I missed the test for it. But some people came to my nursing school and said, we need volunteer nurses in the poor areas of the Catholic Church. So I did that. My sister volunteered to work with Dorothy Day in Chicago with poor people there, and I volunteered to work with the poor people in New Mexico.
Okay.
And so from there, I've continued on with my dedication to helping people. There's
Hmm.
nothing that feels any better than knowing that you've done a good job to help somebody to change their life for the better.
So what do you do at Gutsy Nurses?
With Gutsy Nurses, the first of all, the book will be very important. But the
Okay.
second thing that I've done is I've created some classes for them. Now, nurses haven't, they just
Uh-oh.
believe, oh, I'm just burned out. There's a kind of burnout if you're working at the 99-cent store selling shoestrings and you're working 12 hours, you got too many customers, there's nobody there to help you, you're exhausted, you can get burned out.
Right.
Nurses work in the hospital. They work 12 hours. They've got too many patients. They don't have enough help for them. But additionally, what they have to deal with is that if they don't get to some patient in time, that patient could be harmed or
Hmm.
could even die. And so that's traumatic burnout. So my classes, I'm also a trauma specialist. So my classes have to do with teaching nurses about different kinds of trauma, how it affects their nervous system, what they can do to help release that trauma, and then what they can do while they're working in the hospital to be able to give better care.
Okay. Where do you do these classes? Are they in person or online or what?
I do them in person, and if people want the classes, then I tell them what's necessary for me to bring the class to their community so
Mhm.
they all don't have to travel to where I'm at.
Okay.
We're doing it in person because people need to be heard, be seen, and contribute. And
Okay.
so that's why I like doing it in person.
Okay. All right. How can people get involved in these classes?
Well, you can go to my website, which is gutsynurses.com,
Okay.
and you'll see the email and the telephone number to contact me.
Okay.
Yeah,
All right.
there's
That's
a
good.
description of all the classes, and then there's also some resources. There's a video that explains a new way of treating trauma,
Yeah.
and there are five short little 2-minute videos to tell people what they can do to settle their nervous system if
Okay.
they're feeling anxiety or too much stress.
Okay. Now, I saw also online that you do stand-up comedy. What the
I
heck?
I love theater, and I'm a member of Screen Actors Guild and the AFTRA, the
Yeah.
Association of Television and Radio Actors. At
Yeah.
any rate, I thought I'd give stand-up comedy a try. I
Yeah.
was the worst one in the whole class. I was just terrible. And we had to do a performance at the end of the class. So I thought,
Uh,
oh, I got to do something. So I threw all my material out. And I am so comfortable on stage. I
yeah.
just wasn't funny. So then I learned how to be funny. And the last time I performed, it was at a conference with about 350 people, and it went really well.
Oh,
So,
that's good.
start out with something and not be good at all, but just
Uh,
hang in there. Give yourself permission to develop and to grow and to
yeah.
not be perfect at the very beginning.
That sounds really cool. It really does. Do you do this like at old people's homes, nursing homes, and places like that too?
Now, I've done it at comedy clubs at nighttime.
Oh, have you really? This is real stuff. This isn't just
No, yeah, no, and I've also done it in conferences. I much prefer a daytime conference than I'm not really one of those nightclub type people.
okay.
And then you never know what life's going to bring you.
Well, that's true.
Yeah, I had done a little bit of acting, and then I decided I was never going to do that again.
Yeah.
So Anyway, I took a class. It was taught by a director from Hollywood. And she said, "Oh, we're looking for a stage manager for a play that my husband wrote. We're going to perform here in town." So I
Mhm.
raised my hand and said, "I'll do it." Chose me to do it. And then I went home and I called my old acting teacher and I said, "What do stage managers do?" So I never pass up an opportunity.
Hey, you know what? I know what that's like. I used to have before I retired, I had a communications business, and it sounds like a lot more than what it really was. I was a one-person band with some freelance help, but I was working for trade associations and some candidates and some publications. At any rate, people would say, "Can you do this or that?" I'd always say yes. Oh, of course. Absolutely. That's in my
Right.
wheelhouse. No problem. Then I'd have to go back and figure out what the hell am I supposed to
Yeah,
do.
exactly. But it's an
But I always
opportunity.
did it.
Yeah.
Oh. All right. So let's see what I had some other things I wanted to talk to you about. You say that nurses are innovators, finding ways to keep people healthy and out of the hospital. How are they doing that? What kind of innovation are you talking about?
There's a lot of nurses who are doing something called healing touch, which is like Reiki. And I'm a former instructor in healing touch as energy medicine, where you can help people heal using techniques with energy medicine. And it's very effective. It's been around for years, hundreds, thousands of years. And it has goes by different names. I mentioned healing touch, but also Reiki. And different countries in the world call the energy different things. So in Japan, it's Ki,
Mhm.
China, it's Chi, in
Mhm.
India, it's prana, Prana. Scientists will say, oh, it's energy. And Native American or indigenous communities call it Great Spirit. So you're working with the unseen, you're working with the unknown, which is where the power is. You're like a channel for this to come through. So that's one thing, that's energy medicine. Then there are nurses who are starting businesses with essential oils. And the latest big thing for nurses is coaching. So they're coaching people how to stay well. And they can evaluate what their medical needs are, make sure their medical needs are taken care of, and then guide them to a healthier lifestyle. Because we all know we need to take care of ourselves better, but a lot of us don't do that. We just get
Right.
too busy and we forget about it. But
Right.
if you're working with a coach, then that there's more of a commitment there, and it helps you to develop habits that are healthier for you.
These alternative approaches that you're discussing, I'm curious to know if they are helpful for people with dementia.
Some of the approaches you have to, like a coaching, that wouldn't be helpful because people with dementia don't have the enough consciousness to
Right.
be able to follow along.
Right.
But some of the others, using essential oils can help calm people. Energy healing can help calm people. And then dementia, they're talking about diet with dementia and
Mhm.
how that affects the immune system and it affects your ability to think. I would have to do a little more research on what
Okay.
holistic methods could help people
Oh,
with dementia.
okay. All right. That's interesting. Talk to me a little bit about Gutsy Nurses Save Lives, your book.
Most nurses today are a lot younger than me. And so they're used to having a practice where they're really considered data collectors. They
Okay.
just give us the data and move on,
Uh-huh.
kind of thing. And so my book, I became a nurse way before managed care, before for profit, where we really gave really deep level connection and caring to our patients. It was a kind of thing where you walked into the room and the patient felt safe and they felt better. And when you feel safe is when you can do a better level of healing. So I'm going to be writing about what care was like before managed care or for-profit care. Then I'm going to include how did the system change? What were the things that happened slowly over time, and we ended up where we are today. And then the end of the book will have interviews with people, nurses, and also doctors who are out there bringing new forms of healing into the world today.
Very interesting. Do you have a timeline for this?
By the end of the year,
Okay, but you're still writing it, right?
still writing it. Yeah.
Yeah. Okay, good. I'm glad that you gave us the heads up even before it's ready to go.
Yeah.
Well, that's great. So tell me this, why did you choose nursing as a career?
I think I was raised Catholic.
Yeah.
And my parents were like progressive Catholics and into social justice. And I had a couple of aunts who were nurses.
Hmm.
In the 50s, your choices were to be a teacher, a typist, a secretary, or a nurse. And I thought, oh, the nurse is a much better deal. And then when Kennedy came to Michigan, I thought, I got to become a nurse and help people.
Did you say in the 50s or the 60s?
I grew up in the 50s, but I graduated in the 60s from nursing.
Okay, I got it. All right. So you
In
and I are
the
about the same.
formative years. Yeah,
You
yeah,
and I are about the same age.
yeah. And
Okay.
my mother had 9 kids, and she also, I'm second oldest, and she also ran a daycare because that's another thing that women could do, the only other thing women could do. And I was very good at helping out with the kids
Okay.
and anticipating problems and solving problems. Nursing was a natural for me.
Okay. All right. So what prompted you to launch the Gutsy Nurses program?
The fact for the last 20 years, I've been working with traumatic stress,
Okay.
and the knowledge that I've obtained in that helped me to really understand how traumatized nurses and patients are. And that motivated me to do something about it. I've got to do something about it. Can't just let it go.
Do you have any advice for young people who are both men and women who
Mhm.
are considering nursing as a career?
The advice I have is keep your options open to find out what real care is like. You're not just a data collector, you're
Uh-huh.
more than that.
Right.
And your presence, and that's one of my classes called Healing Presence, your
Okay.
presence can bring a sense of hope to your patient, to not forget those kind of things. And
Okay. All
yeah.
right. Very good. I've run out of questions for you. Do you have anything you'd like to add?
No, it's just that things are bad right now,
Yeah.
and people became more aware after that shooting of the United Healthcare CEO.
Right.
A lot of people came forward with their anger at insurance. And
Right.
so we're living at a time where people are becoming more conscious about getting their needs met and
Right.
changing the system. So it's very exciting. And I think there's going to be a lot of really new and wonderful approaches that people are going to be learning about how to keep themselves healthy and how to heal.
All right. Thank you so much, Kathy Allen, for being with us on the Lean to the Left podcast. I appreciate it very much. Learned a lot and wish you the best with your work and your book.
Thank you so much. And if anybody has any questions, feel free to contact me, gutsynurses.com.
Okay, great. Hey guys, I'm Bob Gaddy, founder and host of Lean to the Left. I'm excited to share our new book, Hijack Nation, Donald Trump's Attack on America's Greatness, co-authored with political analyst and professor C.J. Waldron. In Hijack Nation, we delve into the unfolding story of America's political landscape through a series of essays from leantotheleft.net. We explore how Donald Trump's presidency has transformed American politics, challenging our values and institutions. Hijack Nation isn't just a book, it's a call to action. It invites you to reflect on what it means to be American in a divided political landscape. Together we can reclaim our nation's greatness. So get your copy of Hijack Nation today. Visit leantotheleft.net and click on the Books tab to learn more and to order.